Stroke is scary for so many reasons. One reason is that it feels like something that is out of our control, something that happens to us. But there are actually many risk factors that you can control. Hello, and welcome to House Calls. I'm Dr. Eduardo Sanchez, Chief Medical Officer for Prevention at the American Heart Association. With me today to talk about controlling risk factors for stroke is Molly McDermott, Associate Professor of Neurology at the University of Michigan. Dr. McDermott, welcome to House Calls.
I'm delighted to be here, Eduardo. Thank you.
Before we jump into controlling risk factors for stroke, tell me a little bit about the ones we can't control.
So we talk about risk factors we cannot modify. Generally, we think about genetics. So we inherit our genes from our parents. There are risk factors embedded in our genes that we really can't do anything about no matter how hard we try. And that's the roll of the dice. That's what we're given. That's our inheritance. And we have to do the best we can with the risk factors that we can modify.
And the good news is there are a lot of risk factors that we can control, treat, and improve. That list includes high blood pressure, smoking, diabetes, diet, physical inactivity, obesity, high cholesterol, atrial fibrillation, and sleep apnea. Dr. McDermott, what are the risk factors that you focus on with your patients?
When I'm thinking about stroke risk, the two that really come to top of mind are high blood pressure and smoking. Those risk factors greatly increase the risk for stroke. And thankfully, although it can be difficult, we can treat both of those things. So smoking cessation or reduction for folks who do smoke cigarettes or other tobacco products is really, really important, not just for brain health, but also for heart and blood vessel health. And then blood pressure, over time, if our blood pressure rises and our brain is kind of vulnerable to this high blood pressure day after day after day, it can be really hard on our brain tissue and our blood vessels. And so we really recommend paying attention to blood pressure.
What are other risk factors that you emphasize with your patients?
Physical inactivity is a risk factor for stroke, and it can be very common in our modern age. So I try to tell my patients if they can get out even a couple times a week for a brisk walk, hey, that's better than just sitting and not getting any exercise at all, and I think a lot of people feel like that's achievable. The other modifiable risk factor is diet, and the truth is we don't have great data about diet because diet is such a difficult thing to conduct clinical trials about. But our best evidence suggests that eating a Mediterranean diet is the best way to prevent heart disease and stroke. And if you Google what a Mediterranean diet consists of, you'll read it and say, okay, this tracks with what I think I should be eating.
Yes, a diet that emphasizes fruits, vegetables, healthy fats, beans, and seafood. Not a lot of red meat or processed foods. One controllable factor specific to women is hormonal birth control. Can you talk about that as a risk factor for stroke?
Hormonal birth control does increase the risk of stroke. It's important to know that that may bring your risk from very, very low to very low. So it's not as though we're talking about an epidemic of people having strokes from their hormonal birth control. But it is important to know that smoking really increases the risk of having a stroke when people are on hormonal birth control. So it is really important for women who are on hormonal birth control to try to quit or decrease the amount they're smoking to reduce their risk of stroke. Super important.
Well, let's talk about stress. Many women are taking care of children or aging parents, or children and aging parents, in addition to working and dealing with all the normal pressures of life. So for women in high stress situations, how can they decrease their chances for stroke?
It's really easy to stand here and say, well, you should reduce your stress. Well, we all know we should reduce our stress, and of course it's easier said than done. But a lot of people find benefit from regular counseling, talk therapy, talking to a social worker, talking to a psychologist, just a regular conversation with somebody who can listen and understand. In addition, exercise is really important in reducing stress, and it can be a bit of a vicious cycle where people who are super stressed out feel like they don't have time for exercise, and then the cycle continues. And so it's something you have to build into your day, and you have to set reasonable expectations. So deciding you're going to wake up at 5 a.m. and run 6 miles before you wake your kids up, I don't know, are you really gonna do that? Try to pick something reasonable. When my kids are taking a nap, I'm gonna take a 20-minute brisk walk on the treadmill, or I'm going to dance in my living room, something achievable that you can build into your day that's realistic and sustainable.
You like to dance in your living room too. I love it. We've talked a lot about controlling risk factors that can prevent a stroke, but if someone has already had a stroke, what do they need to know to avoid having another stroke?
When we talk about secondary stroke prevention, which means how do we prevent you from having another stroke after you've had a stroke, a lot of that care is informed by where the stroke came from, what caused the stroke. So for instance, people with small vessel strokes or the strokes involving the blood vessels deep inside the brain benefit a lot from blood pressure control. Patients who have a stroke related to atrial fibrillation, which is an irregular heart rhythm that allows clots to form and potentially shoot upstairs and cause a stroke, they benefit from having their blood thinned so that the clots can't form. For patients who have a stroke related to atherosclerotic plaques, like cholesterol plaques on their arteries, then controlling cholesterol can be very, very important. So a lot of the recommendations we make about how to prevent a second stroke are informed by what caused the first stroke.
That's really helpful, Dr. McDermott. Thank you so very much for joining us on House Calls. You've given us a lot of valuable information. It's been great talking with you. Let's recap some key takeaways. Major stroke risk factors that can be controlled include high blood pressure, smoking, and diabetes. Managing blood pressure, quitting smoking, being physically active, and eating a healthy diet can all decrease your risk of stroke. If you have questions about health conditions, I'd love to hear from you. Comment below, hit subscribe, join me here next time for Answers You Can Trust.